We're here with Mia St. John, professional boxer, mental health advocate. How are you?
I'm doing okay considering. Thank you.
So tell us what's going on that you've seen firsthand in Los Angeles in the mental health community. What's going on with people with disabilities, and how can we help?
Well, it's been so incredibly difficult, especially because I serve the homeless population. So, the shelter that I have my programs at, we've cut services, and my program is not currently running, as many programs are not running. Um, and it's been so difficult as far as getting food to them, getting services to them. Even the food bank on our side, on the west side, they're not accepting any volunteers, no donations, because they don't want to contaminate their workers, their employees. So it's been very difficult, and I've just basically been on foot, buying groceries for the homeless and giving gift certificates to them, to grocery stores. But it's so sad because they are the hardest hit, and I don't think a lot of people realize that our elderly homeless are the highest risk.
How do we strike that balance of protecting the spread of coronavirus and also at the same time helping the houseless population by delivering much needed services and food?
It's tough. I mean, I think that there has to be a balance of some sort, right? Like, there's so much fear that has been embedded in us that our citizens do not want any contact with our homeless people. And our homeless people, especially in Santa Monica and Marina Del Rey and Playa Vista and areas like that, they rely on the help from the tourism. And because we have no tourists, they're kind of left out of luck. And because our services have been stopped at the shelters, or a lot of the services, it's been difficult. They have no way of getting any help. My personal choice is I don't want to infect anyone, but I don't want anyone to suffer if I can help it. So what I do is I continue to help them, but I stay away from loved ones that are high risk. So yes, I'm sacrificing being with loved ones that are high risk, but I feel like I'm much more needed in the population that I serve.
We see, for example, schools in terms of their cafeteria food and servicing the population of students who relied on school lunches. Those, in many sense, are remaining open, but it kind of seems like if you can do that with students, you can also do that with the homeless population. But it does seem that the homeless population is being a bit stigmatized, during the coronavirus as being carriers.
They are, and you can see that when you're walking around town and you see that people don't want to get near them or touch them. And I get it, everybody's afraid right now because that's all we see on TV is, oh my God, fear for your life. But I just feel like there has to be a balance. Like, we cannot ignore this population. And you have to realize, like, when they're saying stay at home, everybody stay at home, and you get the luxury of staying at home, they don't have that luxury because their home is the streets. So they don't have the luxury of staying at home in a nice warm bed with, still getting meals. And I had a friend say to me today, well, they can have their food delivered to them. Well, that's interesting. I don't understand how that happens when you don't have a cell phone and you don't have money to have your food delivered. I mean, it's just mind-boggling the way people think during these times. I feel like it's almost like every man for himself. Just save yourself. And for me, I feel like I I'd rather put myself at risk to help others, but again, not stay away from my loved ones that are high risk, because I don't want to hurt them either. But there has to be balance.
So one of the things you've also been very vocal about on social media is that AA meetings, Alcohol Anonymous meetings, have been disbanded as we've been having these guidelines of social distancing. But at the same time, alcohol, which is one of the single largest killers of Americans, has been promoted as an essential service. So can you tell the listeners and viewers, what concerns you have about reducing AA meetings while essentially promoting alcohol as an essential good?
Right. Well, it was interesting because, I rely on my AA meetings, and now they're all online, which people like me we need that support, that physical support. Like, we need to be around, our sober buddies, so to speak. But again, before I get to this, let me just tell you, I was just so angered when I heard Mayor Garcetti on the news saying how he's now going to give our citizens a treat. We're going to now get alcohol delivered to our houses. He's going to allow that because he thought it was like a special treat for us. And I thought, wow, that's really essential, is to have alcohol delivered to our houses. But yet our AA meetings are not considered essential. Yet, like you said, we have far more deaths, alcohol-related deaths, than the coronavirus. We have over 3 million deaths annually, which far surpasses the coronavirus count. So that's just mind-boggling, because to me, our AA meetings should be considered essential. People have to remember that even though they're saying that AA meetings are allowed online, you have to remember the homeless a lot of them don't have access to the internet. And a lot of my students in my programs, the majority of them, I would say 99%, have alcohol and drug problems, and they don't have access to the internet. So online meetings are irrelevant to them.
So what advice do you have to alcoholics, recovering drug addicts who are now seeing a lack of services during this pandemic? What advice do you have for them?
Well, my advice to the alcoholics in recovery that have access to online meetings, yes, use the online meetings, use whatever you can, meditation, exercise, whatever you can use.
Any particular website that you use or could recommend that's a free website or a free service?
Oh yeah, you can go to alcoholicsanonymous.org, and all the meetings are listed on there. And sometimes Zoom will you can have like 1,000 people in attendance. And I know it's really difficult for those of us that want to share and get our feelings out. And I say call people, because that's what I started doing. I started calling my sober friends, like, hey, you want to talk? As far as the homeless that don't have that access, I'm still trying to figure that one out, because I don't know where to send them or what to do for them.
And it's probably people like you and me who, have a voice to advocate for our government, that the same types of programs we have for students in need, a lunch, we can also have that as well for homeless people, and we don't need to stigmatize homeless people. This coronavirus is the great equalizer. We've heard about prime ministers and billionaires and NBA players who, are infected with COVID-19 at the same frequency as your houseless, homeless population as well. And so it sees no color, it sees no race, it doesn't see money, and we need to treat everybody, with respect, because we're all in this together.
Right, and it makes me so sad, because like you said, we've heard all about the celebrities that have contracted it, and the politicians, and all the famous people. But what you're not hearing is that there's a lot of homeless people that have come down with it. One of our shelters in LA, I think it was 3 people or more that possibly more that came down with it. But we're not hearing about that population that's infected and the lack of testing that we have for them. And I think it's interesting how we have so much testing for our athletes and our politicians, yet it's like the lower down the ladder you go, the less and less access you have to testing and even care. So to me, it's like our highest risk population is the least or the most underserved, which I find it interesting.
Well, thank you so much for your time. I appreciate it.
Thank you so much, Ben. Thank you.
It was great talking to you.